So let's get started. I want to hand our mic over to Dr. Lawrence Piro from the Angeles Clinic, and he will begin the program. Thank you.
Thank you, Samantha, and welcome to everyone. It is the pleasure of the Angeles Clinic and Research Institute to have been partners with AIM for now 12 years. AIM is a fantastic organization. I think we should take a moment to recognize that in this past year, we lost Valerie Guild, who is the founder of AIM. AIM has done so many good things for melanoma patients and for raising the understanding of melanoma, bringing together investigators focused on research in melanoma. There are many people who rise up to be advocates, but it's unusual the advocates who actually are able to create organizations that are responsible for change. And I think we can include Valerie very much in that small club of people. And we're grateful to her life work and the impassioned way in which she approached founding this organization. It's been our pleasure to partner in public education with them. And this is our 11th symposium in 12 years. I think this symposium shows when leading institutions and leading investigators come together to educate patients. It's a beautiful thing. We enjoy it so much, but it's an important thing because for most of us in this panel, when melanoma care was delivered, a couple of decades ago, there were really very few options other than surgery and a few other things. And now we have a huge number of options. Not only does melanoma have a wide spectrum of treatments available of different types, but melanoma has actually served as a disease model from which many of those treatments have been developed and then spread to other cancers. So melanoma has been playing and is playing a very important role in the clinical research and translational research realm of really all cancers. And so I'd like you to think, as you hear about the many different present and future treatments you're going to hear today, think about a word which has entered our vernacular of clinical treatment at the present that didn't exist before, and that's sequencing. Just think about sequencing, because we talk now a lot about how do we sequence the treatments, especially in advanced melanoma and other advanced cancers, so that patients get the greatest benefit, the greatest longevity, and when possible, the greatest cure rate. We have so many different things now. We have to think about what's the optimum sequence of how we administer them. Where do we fit in clinical trials versus standard of care, et cetera. So as we go through this, it's very interesting to know that we're in such a land of riches with regard to therapies, that we have the great privilege of thinking about the optimum way to sequence therapies for the best patient outcome. Joining us today are our many friends who have been with us repetitively in this conference and have made it such a great conference. There are collaborators on the national level, and our clinics and institutions have worked together on clinical trials. So it's a great pleasure to host all of you. We have new to the Angeles Clinic is Dr. Inder Memi, who you'll be meeting, who's a new member of our skin cancer program. We have Mark Ferries, who's our Director of Surgical Oncology and co-director of the Melanoma Research Program, a world-renowned surgical oncologist specializing in melanoma. We have our long friend, Jeff Weber from NYU, who we have known for decades, since he was here at USC, and he's been an international leader in thought and contributor in research in melanoma. We have Ryan Sullivan joining us from the Harvard program, who's been a great contributor, and there's a long and spectacular legacy of melanoma contributions there. We have Rich Carvajal from Columbia, who's an amazing person as well as an amazing researcher, and it's been so great to interact with him over the years. And then finally, that brings me to Dr. Omid Hamid, who's co-director of our melanoma research program and director of research at the Angeles Clinic. And it gives me great pleasure to introduce him, who is the chair of the conference, to take over and lead you through what's going to be a very exciting next several hours. So as you join us from across the United States, and it looks like more than at least 10 countries, including Australia, Poland, Spain, Ireland, England, and more, we welcome all of you. We hope that you find this information generally interesting. We hope you find it interesting and helpful in terms of your own care if you're a patient or the person that you love who you're joining to think about. And we hope you'll spread the information from this conference so that others may benefit from this knowledge and help in the guiding of care. Thank you very much. And let me introduce Dr. Omid Hamid.